Okay, good morning. It is November 2nd, 2020. This week we will be concentrating on the skeletal system and Mr. Chris's favorite occupation, which is related to physical therapy. If you want to be an athletic trainer, if you want to be an oral surgeon or something dealing with orthopedics, this is what some of the things you will know. Now, of course, we're only going to cover the basics, but I will show you some things that are inside these basics that you will need to, if you're going to go into that profession, you'll need to know them and commit them to memory. All right? All right, skeletal system, here we go. Function of the skeletal system: support, framework that supports body and cradles and soft organs, protection, movement, mineral storage, and blood cell formation. These are some of the things you should have learned from the last lecture when we went over just body systems. So that's just something that shouldn't be foreign to you. All right. Supports a framework, of course. The skeletal system is how we stand up. Okay. Without muscles and the skeletal system, we could not stand or walk. We walk via a lever system. All right. Bones attached to ligaments, ligaments attached to muscles. When these things fire, they move and they help us move. Okay? Protection of delicate organs. Of course, your brain, your skull is the main thing it protects. Lungs, etc. Bones act as levers for muscles, okay, for movement. That's what we just talked about. Mineral storage. Sometimes we take for granted mineral storage. Okay? Mineral storage is a big deal. Okay? The bigger the bone is, the more minerals it stores. Okay, you know that. All right. Types of bones: long bones, short bones, flat bones, irregular bones, and sesamoid bones. Okay. You will need to know these. Okay. You will see them on a quiz in the near future. Okay. Long bones, know what those are, know how to identify them. Not only know what they are, but know what to identify a long bone. Okay, short bones, same way. Flat bones are your ribs, scapula, okay, which is on the back side, skull, sternum, which is here. All right, irregular bones, the vertebrae, some facial bones, and a sesamoid bone is your patella, okay, or your kneecap. Okay, knowing where these are very critical. Okay, knowing where they are very critical. Now, I will tell you this little caveat. On this quiz, I will give you directions in the way that you have learned them. Okay? Distal, proximal, lateral, medial, superior, inferior. So on the test, you will get the question in that particular fashion. You won't get, what is this? Okay? You'll get what bone is superior to the patella, however, it is inferior to the femoral head. Okay, so your femoral head is right here, and your patella is here. So what bone is in the middle? Which one? This is here. This is patella, right? It is a what type of bone? Sesamoid bone, right? So the patella, what is superior of the patella, but what is inferior to the head of the femur? The what? The what? I can't hear you. Take your mask down. Fibula? No, fibula is down here. Femur, I just told you. I said the head of the femur. You see what I'm saying? So if you don't know where we're going, we gotta, you don't know where the direction is, gonna be an issue. Now, it's not enough for me to put a diagram out and say, oh, like you're in the third grade, and say, oh, identify that bone. Who can't do that? Who can't do that? But if I give you the directional terms, now we're exercising our knowledge in directional terms, and we're exercising our knowledge of what bone we're looking at. Okay? Because when you're in the operating room, they're not going to say, oh, it's the femur. No, they're going to say the anatomical view, it's the right femur, or it may be something that is superior or inferior to whatever they're talking about. Okay? All right. Bone classification. Bone classification. Same thing. Long bone, flat bone. It's just giving you an example of what these are. Okay? All right. Anatomy of the long bone. Okay? Anatomy of the long bone. So here we are. What is this? It is what type of bone is it? Long bone, right? So if you look, this is proximal. Okay? So why would it be the head? This is the head of the femur. All right? It is proximal. Why is it proximal? Proximal means what? What? Closest to the, starts with an A. Attachment. Okay? So this is the femur. Here's the attachment, right? Because it's attaching here. Proximal is closest to the attachment. This will be what? Distal. Because it's still the femur, but it's the furthest from the attachment. Okay? All right? And you got epiphysis and diaphysis. Okay? Now, an interesting thing about the femur is that it has what we call epiphyseal line or growth plate. Okay? So if you want to know how tall you're going to be, or you want to know how tall your children are going to be, this growth plate is what lets you know. So if a kid is already 6'2" and he's in the 7th grade, and this is not nearly close to being closed, then he's probably going to be pretty tall. Okay? Because his growth plate is still growing. Me, my growth plate stopped in the 7th grade. Okay? That was it. 8th grade, 5'8", 5'9", I was done. This thing was completely closed. Okay? So a lot of times people will do that are really infatuated with their kids in sports, especially basketball, or if they think their kids are going to be a lineman or what have you. They will look at how they will go have an X-ray and look at how close that growth plate is to closing. Because once it closes, that kid will probably stop growing. Okay. Hence, people started keeping their kids back, especially in sports. It's called something. But when they noticed that the kid wasn't as advanced as, say the kids in the 5th grade or 6th grade, and they weren't as athletically advanced as the kids that are in the same grade, they would hold the kid back. So the kid would be equal or better than the kids in the grade that was below them. So there's a lot of things that people do to gain athletic advantages in this world. So just to let you know. All right. So you have compact bones, hyaline cartilage. Hyaline cartilage. All right. So you play basketball, Miller. A lot of your if you continue to play basketball in college, a lot of your hyaline cartilage is being worn away. Okay, it's being worn away. It may not ever bother you. Some people genetically, this hyaline cartilage goes away. They start having problems with their knees later on in life. Okay, but once that hyaline cartilage is gone, it's gone forever. There's nothing you can do about it, except for go and have what we call a total knee. A total knee is when we put artificial things there so bone to bone doesn't rub together. Okay. This is Robert. Good morning. Who's that? Virtual. Mm-hmm. Yeah, she only came once or twice. Yeah. Okay. Okay. All right. All right. So the hyaline cartilage is just so that two bones don't rub together. Because I've heard, it's never happened to me, but I've heard it's very, very, very painful. Okay? So when you do a total knee, what happens is they cut this part, they go and cut the bone here. Okay? Mostly older people have it, people that play sports. Baseball, not so much. There's not a whole lot of wear and tear on your knee in baseball. But basketball, track and field, or long distance running anyway, those have a lot of wear and tear on that hyaline cartilage. But what you do is you cut it right there. Okay, you cut it right across there, and what we do is put what we call anastomosis, and it's just a metal plate that we put on both sides. They'll hammer one up in here, and they'll hammer one in the femur, not femur, in the radial, and it, whatever that, I can't even remember now. But they'll hammer one down, and it's got the soft on the end where you don't rub bone to bone. Okay, so just so you know, all right, axial skeleton. Okay, axial skeleton. Axial skeleton is not something I'm going to harp on or drill, but when we get to cervical, thoracic, and lumbar, we will talk about those, and I'll point out some things that you need to know. Okay, just know that these are the costal cartilages right here. Know what those little blue things are, and they're softer. Okay, if you ever looked at people doing CPR, when they push down on you see the chest is going in and retracting, going in. If all the bones were rigid, like these here, are hard, you wouldn't be able to push on somebody's chest and have that recoil. Okay? So everything has a purpose, guys. Everything has a purpose. All right? So those things you can move. If you notice, they're right here in the vertebrae area. Okay? It's so you can move back and forth. Okay? So you can bend somebody backwards. Okay? So when you turn to play baseball, you're able to swing and it doesn't crumble totally. Okay? Those things like that. All right? Know those bones. Again, I'll give them to you with directional terms, so not a big deal. All right? I'm not going to go so much on the skull. If you decide you want to be a brain surgeon, they'll teach you that. Okay? Sinus cavities. Know that these are your sinus cavities, okay? Here and here. Anybody have sinus problems? Nobody? Nothing? Okay. Good. Because when you have a sinus infection or something like that, that's when these cavities right here will fill up with fluid. Okay? They'll fill up to about right there. All right, they'll fill up with fluid and it hurts like the dickens. I just got over sinus infection about a week or two or so ago. And if you put your head down, right, to tie your shoe, and you get up, it feels like somebody took a gun and just shot you in the head. It hurts terribly. And I think what I did was I let mine go too long before I got some kind of antibiotic for it. But these little cavities right here, they fill up with bacterial fluid, and it hurts like crazy. Now, if you have sinus problems, sometimes they'll just inflame with the bacteria or the stuff in the air. It'll just aggravate them, and you just have to get something to bring that inflammation down. You don't necessarily have an infection. You just have something to bring the inflammation down, okay? But it's an ongoing thing. You're not going to get rid of it, so just get used to it, okay, if you have it. All right, so axial skeleton. These vertebral column is what I want you to know, okay? 1 through 7, you need to know there's 7 cervical, There are 12 thoracic. There are 5 lumbar, and there are 5 sacral fused and 4 coccyx fused. And when it says fused, it means that they are together. They're not separate like this, right? You can take this disc out, okay? But if you come down here, all that is fused together. So if you take one out, you got to take the whole out, okay? That's what the fused means.